Good afternoon. My name is Andelene. I'm from Cape Town, South Africa. I'm at StemRX. I have a child with autism, and I'm also a grandmother with special needs children. And I'm conducting an interview with Dr. Pradeep to make sure that parents know that there is hope for us out there, because it's very difficult to raise a child with autism, and we are searching and praying every day that we will get a solution and hope for ourselves. And I think we have found one, and that is why I'm at StemRX and having an interview with Dr. Pradeep to get more insight into what is out there for us. Good afternoon, Dr. Mahajan.
Good afternoon, Andelene.
Thank you for giving me the opportunity to interview you. I've been waiting for this for such a long time.
Oh, pleasure. I mean, like, you have a wonderful experience of this kind of technologies.
Yes, I have a lot of questions to ask you. And most of these questions is for parents to understand how stem cells work and what is available at StemRX, because there's sometimes a lot of confusion between us and our doctors per se. Anyway, so my first question will be, what type of hospital is StemRX, and how did StemRX start?
Oh, the StemRX is a concept within smart technology. This is a StemRX Smart Technology Center. More than a hospital, is a technology-based hospital. So it is designed in such a way which we look into futuristic science which are coming to take over the current treatment failures for many diseases where we don't have solutions to the diseases like cardiovascular, many of them, like you have to go over directly cardiac transplant in myopathies, liver failures, kidney failures, organ transplants. But neurological conditions, most important, it has StemRX that developed with beautiful protocols for neurological conditions. In pediatric for developmental disorders, focusing more, so we are focused on autism as a target for it. Then delayed development, speech problems, cognitive problems, all these come under that category, including Down syndrome and all those things. So this center is designed how to manage this using smart technologies. What the first question when you ask, when we are discussing, you're talking about stem cells, right? That is a part of the treatment here.
All right. So, what are stem cells and how do they work?
Oh, it's a very basic question. Probably most of the parents should be facing this question. Probably, yes. Am I right?
Yes.
Now, this problem comes to understand when you call stem, means it's a master. It's a master cell. The master cell contains the genetic code of a person whose that stem cell belongs. The cell which contains your life genetic information, what you are, who are you, that code defines your entire physical characters, disease pattern, behavioral pattern, likely cancer development patterns, metabolic disease pattern, what is going to come to your life. The cell which has got this genetic code is called stem cell. So first you have to understand this. And when this stem cell has got that genetic code, means it's controlling your entire master function of the body. So that is called a stem cell.
All right. So we've been at what is stem cells and how does it work, but I also want to know, as parents, we heard so many things about stem cells, but what kind of stem cells are you using?
Oh, Miss Andelene, the stem cells what we use are autologous, derived from the patient's bone marrow, plus adipose tissue and peripheral circulation from the blood. Sometimes those cells we use are from the placenta or cord tissue as well, depending on the patient's indication. So we use a combination of these cells and neuroprogenitor cells we use it, so as to get the best results of the outcome.
All right. Is there any major surgeries involved when you administer stem cells?
Oh, many of the patients may have a big question of this kind, I believe, because they feel there's a major surgery. But let me tell you, the beauty part of this that there's no surgery. It's just a needle, small needle aspiration, that too under sedation, no anesthesia, local block is given, and it is done. Most safe, no complication, and no pain.
Okay, so I also want to know what examinations do you do before the treatment?
That's a well question asked, because the patient should be aware before they undergo the treatment program. We have a standard protocol of investigations which checks up their biochemical factors, supervitamin factors, hormone factors, and also certain scans we do it. Most important, we look into, if required, MRI or PET scan if required. Otherwise, our technology gives us the background of neurofeedback. Most important, neurofeedback is studying the wavelengths of the beta, theta, delta waves, which are prominent in the nerve functions or brain functions. That gives a feedback to us what is wrong, which wave is wrong, which part of the brain is wrong. That is the idea, to localize the disease for us.
All right. Another question is when you do the treatment, when can we expect changes to happen?
Andelene, this is a very different question, because every child is a different child. Every patient is a different patient. But some of the disease indications are in such a way where you can give instant result, like migraine. You come to me 5 minutes in my theater and come out with a smiling face. Certain conditions may take few days. Certain neurological conditions may take a week or 10-15 days. Particularly if you want to know about the autism or something like that.
Yes, please.
So that at our center, StemRX, the design of the program in such a way, by 10th day or even before that, the child should start showing changes.
All right. What happens during the patient's stay? What can they expect when they are at StemRX?
So there is a standard protocol defined when the patient arrives here. But the moment he arrives, he is given a welcome note from the airport. He has some from the team member of logistic. They pick up from there, make them comfortable, and bring to the hospital. The moment they come hospital, they can go to their rooms, which are booked for them already, where they can rest for some time. There will be a note given to them by therapy doctors and the treating doctors about daily program, assessment, and what are the activities will be done when, with the time factor every day. Date of stem cell therapy, date of intestinal microbiota treatments will be already defined when they come here. And daily program is given to them, what are the activities done morning to evening, schedule with their time, and my therapists personally call them for the treatments and again see that they reach their room properly.
All right. How long is your treatment specifically to autism and cerebral palsy?
That we have a minimum 15 days program in both the cases, and maximum 3 to 4 weeks program.
Okay, then I also want to know how important is rehabilitation? We have heard that rehabilitation is very important after the stem cell. How important is it during the stay and after taking stem cell?
This is a very good question. Normally what StemRX has done, he has created an education portal now. During the treatment, rehabilitation plays a major role here. This rehabilitation, neuro-rehabilitation, reads to one using some kind of electromodulation technologies, magnetic modulation technologies, energy reservation technologies, which help the brains to start firing. These are the therapies. Normally in a speech program, we have modified our program of speech called as an intonation speech program based on rhymes.
Okay.
And third program is training to them parents also is done here. Now, when you go back, StemRX has developed a portal, education portal, where there'll be login ID will be given to the parents. And every day that program which we have taught them here will be on the website. They can get access and continue the treatments at home as well. And weekly they can connect to my rehab team if they need some advices. That's also possible here.
All right. When should we do follow-ups with StemRX when we come to the hospital? Do we as parents need to do the follow-up, or does StemRX do the follow-up to see how the parents are doing?
Oh, that's a good question. We have a policy. We do from our side also. There is a system which goes information to them directly. It's 1 month. Follow-up is important. And they call us or we call them. Or also we call the agencies who respectfully guide them.
All right.
Those also can remind them of the scheduled times.
All right. If there is a problem after discharge, who do we need to contact?
At the time of the discharge note contains 2 doctors and 2 therapy doctors' phone number on them.
All right.
So, if one is not available, second can be connected, third can be connected, fourth can be connected. That we made very easy. They also can be connected with the WhatsApp messages, or they can be connected with the email, or a direct on phone, or they can Google Meets also, they can do it.
All right. Why does our doctors as parents, why do they do not advise us about stem cell therapy or cell-based therapy? Why do they not advise us that there is a...
Yeah, I'll explain you. This science is an upcoming science. There are a lot of myths created by the Google doctors and people. But the best technology is that this one doesn't have any side effect or anything. The beauty of this science is that they improve permanently. So the most of the doctors, they don't advise this to them, because they know once they give this advice and they improve, they lose their patients. So that's one problem. And secondly, they don't have depth of knowledge of stem cells also, because they are practicing the science which is research 50 years before. Textbooks they follow, they don't connect to recent research works. That's a big problem.
Okay. Do you give medications after the treatment?
Yes, we do no medications, but give some nutraceuticals and temporarily some small medications to cover up some symptom for a week or 2, and then they are withdrawn.
Sorry. How many times should we do stem cell therapy?
Normally at StemRX, the policy is not like every 2 months or 3 months or 6 months thing. When we do, we have a bar graph given to them about the improvement pattern. The parents have to follow that bar graph at home. The bar graph should show you if the child continuously improves. They can be just connecting online to see the improvement details. If the improvement of the child is coming down or stopped at some level, maybe after 2 months, after 3 months, after 5 months, 6 months, then they are supposed to come the second treatment. Or if they are continuously improving towards a normal life, they don't have to come.
Okay. Which other conditions do you treat at StemRX apart from autism, cerebral palsy, and neurological disorders?
Oh, that's beautiful. We have a very beautiful patented technology for MSK disorders, musculoskeletal disorders like spine, joints, knee joint, hip joint. We have a standard theme here for the joints, same joint lifetime. That's the beauty of our program. No pain and full range of movement throughout the life. That's the beauty of this treatment. Then in the spine, we don't advise surgery for any kind of spinal problem. We have technology of which is called as epidural stem cells plus the non-surgical decompression of the spine, which is a very beautiful high-tech technology where even the compression nerve symptoms are that will be going away. Then we have type 1, type 2 diabetes, particularly diabetic complications, gangrene, neuropathy for the leg, retinopathy, kidney, all that can be reversed in diabetes using a new technology where StemRX has, which is called the EBU2, and secondly, mitochondrial dispersion interface, which improves the mitochondrial function, that recharge the cells, and the cells which are not functioning will take up the function. The very powerful tool technologies are there. Then also autoimmune diseases. Almost all autoimmune diseases can be reversed. Rheumatoid, ankylosing spondylitis, multiple sclerosis, and name the disease can be reversed completely. A range of plethora is there.
Okay. Would it say, I have heard about cancer treatments. If you are in a very late stage of cancer, can there still be something be done for
Yes, Andelene,
patients?
where you lose the hope in a standard care, where all the chemo, radio, surgical routes are closed, and the life is destined for a month or two. That is a time in the tertiary treatment. We have a treatment based on immunotherapy, cancer cell behavior therapy, a diet program, colon program, supervitamins, natural killer cell therapy, hydrogen therapy, hyperbaric oxygen therapy, ozone therapy, which definitely gives the patient quality of life improvement and also improves the years of life, not with the disease, without pain. That's the beauty of this program in advanced cancers.
Okay. I have many questions for you.
Oh, go ahead. I know you're going to take my examination too.
Do you have a book available that we can read, that parents can read, or
Oh, yeah.
more about stem cells? And how can we access your books?
The books are there which you can access from my website also, or there are certain notes present with my website also that you can access it, or they can go to my research papers on Google or my publications on Google also.
Okay. Sorry, what other therapies do you give that can help our I think we've covered this, but I see I've done this research where are few parents upstairs, so I've asked all these questions. So, what other therapies do you give that can assist apart from stem cells?
Stem cell is a core part of the center, but with alone stem cell cannot do anything. So we have a neuromodulation, we have MSK modulation, we have detoxification, we have hyperbaric chambers, we have vibration therapies, we have magnetic resonance therapies to charge the brain, NES therapy to nano-electrical stimulations. These are all biological research programs are there, biological research regulations programs are there. All these are multiple therapies which are assisting for the stem cells to give the best results.
Okay. Can you just explain FMT? Because there's so many myths about FMT that you... Okay, so we know that one round of FMT can be enough, but there's many people that doesn't believe in it, or they say you have to do FMT multiple times.
So there are two schools of thought. There is a thought process where though repeatedly 3-4 times they do it. But if you have perfect genuine work one time, have a colo wash complete, and then do endoscopically. The whole gut can be put with the healthy bacteria and stem cells in the gut mucosa. That is the best way of FMT. But we call intestinal microbiota transplant, where we develop these bacteria in the lab, which are called Akkermansia, Bifido, Lacto, Streptococci, and pre and probiotics are synchronizedly mixed with it. And all that can be using a healthy bacteria in the gut.
We have heard that it's better for children to start cell-based therapy much earlier, and that older adults cannot be assisted. Is that true?
This is a little myth. Adults also can improve because learning is a lifetime process through synaptic connections. But children, the synaptic connections are already established. So the response is faster. In adults, we have to develop the synaptic connections. It takes time. That's all the difference.
All right. So we can help older adults.
Well, we can.
We have heard that a child of 40 might not be able to be assisted.
Again, I repeat my sentence. About 20 years, 30 years, they can also, through the receptor development, synaptic connection development programs, the speed of recovery or improvement is a little slower compared to pediatric children, but they can improve.
What advice will you give parents when they are back home? What therapies and what schooling and other treatments can they give their children when they're back home to develop to their best ability?
The advice when they go back from here, So we advise to continue peptide injections, growth factor injections, and nebulization of the exosomes or growth factors.
All right.
Or even insulin nebulizations when they go back. Plus, we teach the parents when they are here about various therapies, how they can do particular intellectual therapy, programming therapies, then ABA therapy, intonation program therapies, speech programs, intonation programs, all they are taught. Behavioral programs also taught, and the same programs are given with a Google link to them. They can practice at home also. And every week they can have a video call to my team here so that they are not left in the limbo.
All right. Would you say a child should go back to normal school, to their schooling?
That is the best advice
or
always.
to their daily activities?
That is the best advice always. Don't put them into special schools after my treatment. If you do that, then the child will pick up again those special subject requirements of deterioration in the improvement. It's a big challenge. So I always tell them, don't send to special school, send to normal school. If you don't want to send to normal school or non-admission, be at home. And you participate with him. With the normal children, his friends coming. But no special children.
Okay. What message will you give parents and loved ones who ask for that there is no hope? What will be your message?
My message to the parents, there is a big hope. If you know the science, the children are smarter, very smart. They are not idiots, autism children. They are very smart. I can tell you multiple examples. Autistic children who have become the laurels of the world. Mozart was autistic. Ramakrishnan, who is the biggest mathematician, he is autistic. Likewise, I can give 100 examples to you. If you are knowing the parent relationship to the child, how to build up them, then there's no problem. They can go to normal school, they can have a normal and lead a successful life.
And you will say that stem cells can be part of helping your child?
Definitely.
All right. There's one other thing. In my personal life, I've been battling this, and so most of the parents that knows me, I had a son with autism.
I know.
Yeah.
You discussed me sometime.
Yes, and my son passed away because of an epileptic seizure. Is there hope for parents of children with epilepsy?
That's a very good question.
Very devastated.
I know, it's a very good question because most of the parents have been misguided. That cannot be treated. But let me tell you, there are treatment programs with me which can eliminate complete epilepsy. Complete epilepsy. And child can live a normal life. Whether it is autistic, CP, or any kind of only epilepsy, they can be cured.
I think the message that I will take away from all of this is if we don't try, we will never know, and we should not lose hope.
Yes.
Because StemRX is sort of a light out there for us to say,
yes,
we are here, try, that's all we can do.
Well, you said at the conclusion of the meeting.
So I want to thank you very much for this meeting, and I hope we can have many more of this.
Please, we will look forward to make this educational program to the parents, to the teachers, to the doctors, so that the communication gap of knowledge, science will be reduced and accessibility of the technology can go to the people who need it actually.
That's very true, because many parents say they have to Google. So if we can take it into the world and tell parents that this exists, then hope will definitely be there. And thank you very much.
Please, thank you here. Thank you.